Vancouver East.
Mr. Speaker, the Conservatives are balancing the books on the backs of provinces. Without any consultation, the Conservatives unilaterally rewrote the formula for federal health transfers. Their plan means higher costs for provincial budgets and fewer frontline health services for families. Mr. Speaker, provinces deserve to have a say. Why won't the Conservatives get back to the negotiating table, and why are they playing hardball with the provinces on health care?
The Honourable Parliamentary Secretary to the Minister of Finance.
Thank you once again. Our government is committed to a publicly funded, universally accessible health care system. We all use the health care system. Our families use it. Our friends use it. We want to see a strong, sustainable health care system in Canada, and that's when you need it most. Let's be clear, under our government, health care transfers are at record levels, from $20 billion when we formed government to $27 billion this year. Unlike the old Liberal government, we have not and will not slash funding to provinces for health care. Thank you.
Vancouver East.
Why did they make unilateral decisions? And the fact is that healthcare costs will be higher for the provinces because of their decision. On another important healthcare issue, Mr. Speaker, there have been warnings for the last year and a half about severe drug shortages, which many critical ill patients are now facing. So what did the minister do in response? She created a website. Well, that's cold comfort for those who would need those prescriptions. Will the minister now concede that this plan was completely ineffective, and will she explain what the government will do to address these recent shortages?
Thank you very much, Mr. Speaker.
Order.
Our government is playing
The Honourable Parliamentary Secretary to the Minister of Health.
Thank you very much, Mr. Speaker. Our government is playing a leadership role when it comes to dealing with these drug shortages. We're doing our part to ensure that information about drug shortages are made available as quickly as possible. For example, the Minister asked industry to work together to establish a national one-stop drug shortages monitoring and reporting system. If some industry players do not meet their responsibilities in providing information in a timely manner, we will consider all options to address that. Thank you, Mr. Speaker.